it will more than likely be coronavirus inundated with stuff that's happening, but you want to know what's going on with the coronavirus. And so I'll read you what the Acadiana Advocate printed this morning. We'll start off with an article by Claire Taylor called "The Spread May Be Slowing." And today is Wednesday, April 8th. More than likely be coronavirus inundated with stuff that's happening, but you want to know what's going on with the coronavirus. And so I'll read you what the I had my earbuds in. We'll start off with an article. There's a delay. Claire Taylor. I was hearing the spread maybe talking, and today is Wednesday. So let me read you the first story by Claire Taylor. It's called "Spread May Be Slowing." Acadiana adding virus cases, but at a decreased pace, by Claire Taylor. And one more shout out to Matt. Please call me if my audio is not coming through. Just let me know for sure. I appreciate it. The number of the spread of the new coronavirus in Acadiana may be slowing. The latest data from the state health department suggests, and we're seeing slowing down in other parts of the world. And there were reports yesterday in New York that things were beginning to level out a bit. We still need to be very, do all the things that we've been doing, washing our hands and social distancing and all that. That's going to be for a while, but hopefully we're getting to the slowdown part. So the number of coronavirus cases in a 7-parish region of Acadiana increased by 42 on Tuesday, which is 22% lower than the number of new cases reported on Monday, continuing a slowing trend that began over the weekend. Lafayette Parish, which had been reporting more cases than any other parishes in the region, added only 12 new cases between Monday and Tuesday, and a 5% increase for the second consecutive day, compared with double-digit percentage increases in weeks past. A week earlier, on March 31st, Lafayette Parish had 38 new cases of COVID-19, a 44% increase from the prior day. The only new death attributed to COVID-19 on Tuesday in Acadiana occurred in Lafayette Parish. Let's see. Governor John Bel Edwards said Monday that Louisiana could be flattening the curve thanks to the stay-at-home order he instituted 2 weeks ago. Lafayette Parish Mayor President Josh Guillory, during a Tuesday afternoon news conference, said the rate of confirmed tests in the parish is about 4%, among the lowest in the state. That number, he said, is a little misleading because some tests performed in Lafayette for out-of-parish residents are counted with Lafayette Parish, while the positive results are counted in the parish where they reside. Our relatively low rate of positive tests is a positive sign that our social distancing is having an impact, Guillory said. We are still experiencing a substantial increase in confirmed cases, but if the data for the next few days continues the current trend, we may see the rate of increase starting to slow, suggesting the peak infection is near. After seeing a jump Monday in coronavirus cases in some of the other parishes in the health department in Regions 4, those parishes on Tuesday had smaller percentage increases. Region 4 includes Lafayette, Acadia, Evangeline, Iberia, St. Landry, St. Martin, and Vermilion parishes. The total number of cases reported in Lafayette Parish on Tuesday was 272, up by 12, with 7 dead since the first death was reported in the parish on March 27th. Acadia Parish had 82 cases, up 3. Evangeline Parish had no new cases reported Tuesday, for a total of 23 cases and no deaths. Iberia Parish has 6 new cases, bringing it to 89 with 5 deaths. St. Landry Parish went up by 8 cases Tuesday, for a total of 60 cases and 4 deaths, while St. Martin Parish had the biggest increase, second to Lafayette Parish with 11, bringing it to 101 cases and 4 deaths. Vermilion Parish reported 2 new cases, bringing it to 18 with 1 death. Cameron Parish had its first case reported Tuesday, leaving Kennesaw Parish as the only one of 64 parishes in Louisiana without a single confirmed COVID-19 case. Statewide, the coronavirus continues to spread, with 1,417 new cases reported Tuesday, a 9.5 increase. More than half of the 16,284 cases in the state have been in Orleans and Jefferson parishes. Louisiana lost another 70 lives to COVID-19 to Monday and Tuesday's reporting by the Department of Health. 30 of the 582 Louisiana deaths were in Orleans and Jefferson parishes. As of noon Tuesday, Region 4 reported 115 ventilators available and another 94 in use, 37 intensive care unit beds available and 131 in use, and 826 regular hospital beds available with 151 in use, with another 151 in use. Okay, so we always start out with the figures as far as coronavirus goes. Here's a story about Megan White entitled Area Hospitals Putting Surge Plans to Test. Lafayette hospitals have long had emergency surge plans in place to make way for an influx of patients during a mass casualty event, but they've never had to put those plans in motion before the new coronavirus was detected in Acadiana. Lafayette General Medical Center and Our Lady of Lourdes Regional Medical Center have put their surge plans to the test in recent weeks, primarily by converting existing wings of their hospital into intensive care units to increase the number of beds available for a potential spike of COVID-19 patients. A total of 75 patients were being tested for COVID-19 at the 2 hospitals and their affiliated campuses as of Tuesday, according to hospital administrators. There were 42 people receiving inpatient care and another 20 people in ICU beds because of the virus at Lafayette General Health, which includes university hospitals and clinics, Acadia General, Abram Kaplan Memorial, and St. Martin Hospital. There were 5 people receiving inpatient care and 8 more people in ICU beds because of the virus at Lourdes and its affiliates, including Women's and Children's Hospital and Heart Hospital. Lafayette General has implemented 2 of the 4 phases of its surge plan, while Lourdes has completed 2 out of 3 of its phases. Surge plans are just one way area hospitals are adapting to the constantly evolving coronavirus situation. We all have had to become epidemiologists very quickly to understand the disease and spread of the disease, said Al Patton, Lafayette General's Chief Operating Officer, during a virtual press event Tuesday afternoon. Patton said that he's cautiously optimistic about the coming days and weeks based on the latest COVID-19 models, which predict a smaller spike in cases than previously anticipated. We haven't seen that dramatic surge, Patton said. It's been a steady increase in patients, but we have learned an awful lot very quickly. COVID-19 tests that initially took several days, even at local hospitals, are now taking just hours due to partnerships with rapid testing companies. Medical professionals have been filling in outside of the normal departments as needed. Those workers who are at high risk of COVID-19 are generally assigned to care for patients without known symptoms of the virus. Hospitals are trying to minimize the number of staff members who travel between rooms where patients are known to have the virus and are receiving care for other injuries and illnesses. They've also implemented virtual visits for patients in some rooms, hospital rooms, to minimize the number of medical professionals exposed to the virus. Nurses use tablets to conduct video checkups on patients instead of visiting in person. Lafayette General and Lourdes both implemented new mask policies this week in line with the latest recommendations from the U.S. Centers for Disease Control and Prevention. At Lafayette General, all hospital employees, patients, and essential visitors are provided with surgical masks upon entry. Those employees working directly with COVID-19 patients are pairing those with N95 masks, which provide better protection against infectious diseases. Employees and others who are not working directly with COVID-19 patients can wear a house-made mask instead of the surgical mask. It's really for the protection of everyone else around them. It's intended to protect everybody from asymptomatic spread, said Dr. Amanda Loge, Chief Medical Officer for Lafayette General. And this is in line with CDC, and they're recommending for being out in the public if you have to anyway. Similarly, all LUS employees are provided with either surgical or N95 masks. Visitors and patients are provided with homemade masks. Although personal equipment is still safeguarded in both hospitals due to the global shortage, there hasn't been as much of a concern as personnel and staffing shortages in area hospitals. Healthcare workers and first responders, family, friends, and neighbors who are humble and tirelessly committed to their patients, Elizabeth Arnold said in a prepared statement. We are in awe of the selfless acts of service. Respect the sacrifice by obeying the stay at home for our governmental leaders. It takes all of us to stop the spread. Okay, moving on. COVID-19 coronavirus, the latest. Next school year may start early. Options discussed to make up for closures by Will Suntel. Summer schools starting the 2020-21 school year early and customized education plans. Among the ideas being tossed around is students end up missing more than 2 months of classroom instruction because of the coronavirus. There is going to have to be something that we do to help make sure that we give kids the opportunity to catch up, said Deborah Shum, a former top official of the State Department of Education and a 42-year educator. Right now, there are not a whole lot of answers, Shum said. People are brainstorming to see what are the possibilities. Governor John Bel Edwards ordered the closure of public schools on March 13th, and the shutdown is set to last through April 30th. Most schools are set to finish their year the third week of May, which means classes may not be resuming during the current year, depending on the spread of the virus. Although Edwards has said lost school days do not have to be made up, educators say finding out where students stand academically is crucial in what could be a prolonged shutdown. You can start school in August and say to a fourth grader who was in the third grade last year, you are going to start here, said Mike Falk, executive director of the Louisiana Association of School Superintendents. What happens to that third grader that falls behind? What happens to that third grader that did not have access to Wi-Fi? That is not being fair to the kids. That is not being fair to the teachers. One idea talked about would be to start the next school year early. However, state aid for public schools is based on 177 days of instruction, raising questions about affordability and whether school aid through the $2.2 trillion in federal stimulus bill can help underwrite costs. Summer school is another option, even amid hot weather and other reservations. However, summer school depends on the ability of individual districts to offer classes, which could widen a gap that already exists in how schools are handling the closings. A total of 39 of the state's 69 school districts say they are offering distance learning during the shutdown, including satellite learning, emails, video conferencing, online chats, phone back, and feedback on homework assignments. Falk said those districts could do some kind of testing to see where the students stand academically. How other districts, which are offering students printed packets and other resources, would get a snapshot of the student's academic status is unclear. That list includes the East Baton Rouge, East Feliciana, Iberia, Plaquemines, St. James, St. John the Baptist, St. Landry, St. Martin, Tehanging-Bahia, Vermilion, and West Baton Rouge school districts. Shum, who recently retired as executive director of the Louisiana Association of Principals, said school leaders may be able to draw lessons for how classes were handled after Hurricane Katrina forced the closures of school for weeks or longer in 2005. She said because students missed varying amounts of time, each had what amounted to individual education plans in some schools that helped show where they stood academically. That's almost a picture we're going to have to work with, said Shum, who was a member of the St. John the Baptist Parish School Board. Others are recommending more drastic steps. Michael J. Petrell, president of the Thomas B. Fordham Institute, said in a column for the Washington Post that students who were already a year or two behind at the start of the coronavirus crisis should be held back. Petrelli said decisions ahead for school leaders should impact students' trajectories for the rest of their academic careers. Shane Riddle, director of legislative and political affairs for the Louisiana Association of Educators, said teachers can administer benchmark assessments if students are able to return to classes after April 30th for 3 weeks or so. Riddle says starting the next school year early would be complicated. Most districts have already planned for their 2021 school year as far as their schedules, he said. Next story, deaths coming in clusters. 13 parishes have high fertility rate by Gordon Russell. Let me just scan through this, and they could have information similar to the article I read before. I'm going to go ahead and read it. A cluster of coronavirus deaths that began in New Orleans and spread to Jefferson Parish and St. John the Parish have now made its way up and down the Mississippi River, with 13 Louisiana parishes now among the 50 U.S. counties with the highest per capita death rates from the virus. Epidemiologists say the cluster of fatalities bears close watching, and although it's too early to say what it proves, there's general agreement on a few of the reasons. The simplest explanations, they say, are that South Louisiana has an outsized share of people who are especially susceptible to the coronavirus, people with hypertension, diabetes, and obesity. It is a disproportionately Black area of the country, and new data is making it clear that the virus is killing Black people in greater numbers, in part because they are more likely to have one or more of the items or aspects, medical aspects that make the coronavirus deadlier. Of course, South Louisiana demographics aren't unique. They resemble many areas of the Deep South. The most obvious difference, the experts say, is that the virus established itself here earlier than other places and spread before people realized it. Something similar happened around Albany, Georgia, the only other early hotspot in the region that has seen per capita death rates anything like those in South Louisiana. If I had to guess, I'd say get into those communities early, and those were communities with higher than normal aspects, said Dr. Jeffrey Shaman, an expert on infectious diseases and director of the Climate and Health Program at Columbia University's Mailman School of Public Health. Although the majority of people who contracted coronavirus experience mild or moderate symptoms, people who have died from it typically do so 2 or 3 weeks after first experiencing symptoms, according to studies of the viruses in other countries. Because the virus was identified in New Orleans area earlier than other parts of the country, it's possible that rates of death in other cities and states will start to catch up or even outpace those experienced here. Per capita death rates in Orleans and Jefferson parishes have fallen behind those of some other counties, mostly in and around New York City, that once lagged behind them. But it may be too early to say whether the effects of flattening of the local curve or simply the extent of the misery in the New York area. If Louisiana's steep early toll is mainly a sign of early spread here, other communities with similar demographics and high prevalence of health risks should expect to see similarly high fatality rates eventually, experts said. Of the 13 parishes in Louisiana with the highest death rates, 10 lie among the industrial corridor that lines the Mississippi River from Baton Rouge down to the river's mouth. And notably, every parish along the river from Plaquemines to West Baton Rouge is in the group, save for East Baton Rouge, which is ranked number 52. Section of Louisiana nicknamed Cancer Alley because of the proliferation of petrochemical plants was the subject of a series of reports by ProPublica and the Times-Picayune/Advocate in late 2019 that examined increases in toxic pollution in the corridor amid an industrial boom. St. John the Baptist Parish is among the more industrialized parishes, and it has the highest per capita death rate of any American county to date. Drive-through testing for coronavirus began in St. John on Tuesday. There are other explanations outside of high levels of pollution that could contribute to the high rates of death in the parishes lining the river near St. John. For instance, is home to a nursing home for veterans around the region where at least 12 people have died from coronavirus as of Tuesday, Coroner Christy Monteith said. Pollution shouldn't be ruled out as a cause either. Coronavirus cripples the lungs, and Shaman said it stands to reason that a person whose lungs are already damaged from air pollution would presumably be more susceptible to the disease. I would put that down as something to think about, something to keep investigating, he said. Rebecca Christopherson, an expert in infectious diseases and emerging viruses at the LSU School of Veterinary Medicine, agreed the question demands close scrutiny. The role of environmental factors and exposures is a very interesting question and one that needs to be explored, not only for the particular pandemic situation, but the interaction with other infectious diseases, she said. Susan Hasek, an epidemiologist at Tulane University, who studies infectious diseases in public health, noted that it's difficult to reliably measure the influence of pollution on health outcomes. One of the reasons it's been so difficult to establish a direct link between the industrial pollution along the river and the high rates of cancer and other diseases in some of those areas. There are also possible or plausible explanations. Interstate 10 connects many of the parishes, and New Orleans is a hub for the whole region, all of which could have facilitated community spread. Do the impacts of the chemical industry have any bearing on these rates? We don't have any way to see that yet, Hasek said. But in terms of hypothesizing why these pollutions are so fragile, certainly could be part of the conversation. It's just really hard to disentangle in any systematic fashion. I don't doubt there is some contribution from pollution. I can't qualify it. Is it a 2% contribution, 10%, 30%? I can't say. Okay, now it's time in our broadcast to look at this day in history and the zodiac. So, stay in history. Today is Wednesday, April 8th, the 99th day of 2020. There are 267 shopping days left in the year. Today's highlight in history: on April 8th, 1864, the United States Senate passed 38-6 the 13th Amendment to the U.S. Constitution, abolishing slavery. The House of Representatives passed it in January 1865. The amendment was ratified and adopted in December of 1865. On this date, in 1513, explorer Juan Ponce de Leon and his expedition began exploring the Florida coastline. In 1904, Long Acre Square in Manhattan was renamed to Times Square after the New York Times. In 1911, an explosion at the Bannock coal mine in Littleton, Alabama, claimed the lives of 128 men, most of them convicts loaned out from local prisons. 1913, the 17th Amendment to the Constitution providing for popular election of U.S. senators, as opposed to appointment by state legislatures, was ratified. President Woodrow Wilson became the first chief executive since John Adams to address Congress in person as they asked lawmakers to enact tariff reform. 1952, President Harry S. Truman seized the American steel industry to avert a nationwide strike. The Supreme Court later ruled that Truman had overstepped his authority, opening the way for a 7-week strike by steelworkers. In 1973, artist Pablo Picasso died in Montparnasse, France, at age 91. In 1974, Hank Aaron of the Atlanta Braves hit his 715th career home run in a game against the Los Angeles Dodgers, breaking Babe Ruth's record. 1990, Ryan White, the teenage AIDS patient whose battle for acceptance had gained national attention, died in Indianapolis at age 18. In 1993, singer Marian Anderson died in Portland, Oregon at age 96. 1994, Kurt Cobain, singer and guitarist from the grunge band Nirvana, was found dead in Seattle from an apparently self-inflicted gunshot wound. He was 27. In 2003, kidnapper rapist John Jameslick, who had imprisoned 5 women and girls, one after another, as sex slaves inside a makeshift dungeon in the DeWitt, New York home, was arrested. Jameslick, who pleaded guilty to 5 counts of first-degree kidnapping, is serving an 18 years to life sentence in a maximum security prison. In 2009, Somali pirates hijacked the U.S.-flagged Maersk, Alabama. Although the crew was able to retake the cargo ship, the captain, Richard Phillips, was taken captive by his raiders and held aboard a lifeboat. Phillips was rescued 4 days later by Navy SEAL snipers who shot 3 of the pirates dead. A Russian spacecraft carrying a crew of 3, including U.S. billionaire space tourist Charles Simonyi, landed safely on Earth. 10 years ago, President Barack Obama and Russian President Dmitry Medvedev signed the new START Treaty in Prague. Authorities in Cancun, Mexico, found the body of Monica Beresford-Redmond, the wife of Pimp My Ride and former Survivor producer Bruce Beresford-Redmond, who was convicted by a Mexico court in March 2015 of murdering her and sentenced to 12 years in prison. He was released in 2019. Malcolm McLaren, 64, former manager of the Sex Pistols, died in Switzerland. Bishop Abel Mazore, the first Black prime minister of an interim white-dominated government before Zimbabwe's independence, died 6 days before his 85th birthday. 5 years ago, Tishaket Sarnoff was convicted by a federal jury on all 30 charges against him in the Boston Marathon bombing and found responsible for the deaths of 3 people killed in the 2013 attack and the killing of an MIT police officer. 3 days later, he was sentenced to death in the following month. 1 year ago, the United States designated Iran's Revolutionary Guard Corps as a foreign terrorist organization, an unprecedented declaration against a foreign government. 2 U.S. soldiers and a Marine were killed in a Taliban roadside bomb attack near the main American base in Afghanistan. After squandering a 10-point lead, the Virginia Cavaliers pulled away in overtime for an 85-77 victory over Texas Tech in the final game of the NCAA college basketball tournament. Chris Davis of the Baltimore Orioles set a major league record by going 49 at-bats without a hit, a streak that extended back to mid-September. In today's birthdays, comedian Shecky Green, still alive. He's 94 years old. You go, Shecky. Author and Pulitzer Prize-winning reporter Seymour Hersh is 83. Mouseketeer Darlene Gillespie is 79. Singer Peggy Lennon of the Lennon Sisters is 79. Singer and producer Leon Huff is 78. Actor Stuart Pankin is 74. Rock musician Steve Howe from Yes is 73. Former House Republican leader Tom DeLay is 73. Movie director John Madden is 71. And let's see, rock singer musician Ezra Koenig from Vampire Weekend is 36. And rock musician Jamie Satoria is 27, and actress Sadie Calvino is 23. A thought for today. The world has achieved brilliance without conscience. Ours is a world of nuclear giants and ethical infants. Quote by General Omar N. Bradley, 1893 to 1981. And now we turn to today's horoscope. For those who consider themselves Aries, think before you act. Handle an emotional situation with intelligence and honesty, not with a temper tantrum. Busy yourself with projects that require interaction with others in order to accomplish the most. Taurus, treat yourself to something that will encourage you to look at your options. An opportunity will arise if you get firsthand information regarding something you want to pursue. Geminis, hard work, discipline, and understanding will help you overcome any obstacles. Set aside time to relax with someone who brings out the best in you. Cancer, don't make a change more difficult. Go with the flow. Instead of fighting the inevitable, an open mind will encourage you to see the benefits, not the detriments of whatever situation you face. Leo, your outgoing personality will inspire confidence in others. Events that require physical and mental stability are favored. Step into the limelight and show what you have to offer. Virgo, establish friendships with people who care about the same things as you. Your leadership ability will give you the edge when faced with competition. Broaden your scope and reach for the stars. Libra, don't let anyone slow you down. Follow your heart and stick to whatever will bring you peace of mind. Keep life simple, stay within budget, and say no to demanding individuals. Scorpio, your memory won't let you down. Deal with the past so you can feel at ease moving forward. A change is overdue and a new beginning will set you free. Sagittarius, put a greater emphasis on solid relationships. Refuse to let an outsider interfere with your plans. A commitment will enhance your stability. Capricorn, do whatever it takes to make your environment less stressful. You don't have to go into debt to impress anyone. A positive attitude will result in a cost-efficient change. Aquarius, don't let work interfere with personal plans. If you make a promise to someone you love, be sure to follow through. A last-minute change of plans will prompt an argument. And finally, Pisces, stick to your budget regardless of how tempting an offer might be. Trust your intuition, not someone who appears to have ulterior motives. Be a leader, not a follower. And as always, folks, a horoscope, or horoscope as I refer to it, is an entertainment feature, definitely not based on scientific fact. Maybe a little bit, but usually not. Okay, getting back to the news. Edwards urges people to remain home. Projections improving for New Orleans by Sam Carlin. Some of this we may have already heard in previous news stories, but it's always good to reinforce the information that's out there about the coronavirus. Governor John Bel Edwards on Tuesday implored residents to continue to stay home as much as possible as the state sees data on the coronavirus outbreak, promising enough to cause officials to say the New Orleans region is no longer on track to run out of hospital beds and ventilators in the next 2 weeks. The new projections provide the latest indication that the stay-at-home order issued more than 2 weeks ago could be paying off at a crucial time when the New Orleans region was previously scheduled to start running out of healthcare resources. Edwards warned that letting up on the restrictions now would spell doom to those efforts, but he said he continues to see early evidence that the number of cases is no longer as steep a trajectory, even if they can't say it with absolute confidence. We are seeing early signs that the curve is starting to flatten, Edwards said, but what this means is we have to contribute to do these things that have caused the curve to flatten. What it really means is our mitigation measures are starting to work and show up in the numbers. The exact wrong thing to do is to stop the mitigation measures. The governor and other officials have spent recent weeks soliciting ventilators from everywhere they could as they raced against the clock to surge medical capacity in New Orleans, one of the hardest hit cities in the U.S. The state took drastic steps including sourcing ventilators that would normally not be deemed suitable for intensive care units, and warning that hospitals could resort to pulling multiple patients on one machine. But in recent days, a combination of dominoes have fallen in Louisiana's favor. Fewer patients are on ventilators than once thought, in part because providers are not putting as many patients on the machines, and Edwards called the state's trend on new hospitalizations really good after the rise has slowed in recent days. On Tuesday, Edwards said he has reduced his order for ventilators from private vendors from 14,000 to 1,000 to avoid getting an influx of ventilators the state may not need. However, officials said it's too early to celebrate. Although hospitalizations are tracking better, Louisiana's deaths are still alarming, Edwards said. State officials have said deaths and hospitalizations are the two most important metrics to watch. Louisiana confirmed 70 more deaths on Tuesday, its largest single-day jump, though delays in reporting means many of those happened in previous days. The trajectory we're on, if you just look at deaths, is not so good, he said. And so the two most critical pieces of information are not in agreement with one another as to what's going on out there. We're still a little bit in the dark. The number of coronavirus-related hospitalizations rose by 15 Tuesday to 1,996. That was about 500 more than a week earlier. The number of patients on ventilators has fallen for 3 consecutive days, from 571 on Saturday to 552 on Tuesday. The death toll rose to 582 on Tuesday, and officials have expressed growing concern that Louisiana's poor health outcomes are putting the state's residents more at risk of dying from the virus. And new data released this week by the Louisiana Department of Health shows more than 70% of the people who have died from the virus are Black, a disparity that the governor said is disturbing. Some health officials in the New Orleans area indicated they were seeing positive signs as well. Greg Fern, CEO of LCMC Health, says the system continues to see favorable trends that indicate social distancing is working, and he credited Edwards with helping boost his cachet of personal protective equipment. And Ochsner Health System spokesman said officials there were encouraged by the trends they're seeing, including a preliminary flattening of hospital and ICU admissions and people recovering from COVID-19. Susan Hasek, an epidemiologist at Tulane University who studies infectious diseases, said the stay-at-home order has undoubtedly cut down on infections, but she cautioned against taking too much confidence from a handful of figures over the past few days. Do I think we've got the numbers yet to say that? Definitely no, Hasek said. Definitively no. We're not to the point where I should be confident that we have a trend. Although the New Orleans region is showing signs of improvement, other regions of the state may still face problems in the coming days and weeks. Because New Orleans' outbreak began earlier than other places, testing is further along, and efforts to surge hospital beds and other equipment have centered around the region. I think the anticipation was that Baton Rouge would hit its peak resource date after New Orleans, said Christina Stevens, spokeswoman for Edwards. You would expect to see some other areas in the state that could have issues down the line. Even as the state cuts back on ventilator orders, it is still moving forward with efforts to boost the number of beds in the New Orleans area that are available to coronavirus patients. Private contractors building a 2,000-bed temporary hospital at the Ernest M. Memorial Convention Center, and the state has inked deals for hotels in the region that will be used for similar purposes. Governor said those will be necessary as people without coronavirus who have stayed away from the hospital as doctors delayed elective procedures will have to go to the hospital eventually. And although the state has been encouraging signs in coronavirus patients, he indicated there could always be another surge. Dr. Alex Billio, Assistant Secretary of the state's Office of Public Health, said along with social distancing and the efforts to find more equipment and beds, providers are keeping people off ventilators when possible, driving down that number. He said in conversation with hospital officials, The falling number of patients on ventilators is largely because they are coming off alive, not because they are dying in large numbers. The Department of Health also released new data showing when patients with the coronavirus first started experiencing symptoms as many as anticipated. That data shows that a large number of people have been affected long before they were officially confirmed as coronavirus cases. According to the data, nearly 12,140 people who later tested positive for COVID-19 have first experienced symptoms by March 26. At that time, there were only about 2,300 confirmed cases in the state, and it would take more than a week for the official count to catch up. This story was also written by staff writers Emily Woodruff, Brian Stoll, and Jeff Adelson, who contributed to the story. And the CDC agency did not tell states to stop naming nursing homes, by Feynman A. Roberts III and Sam Carlin. When Louisiana health officials announced they would no longer name individual nursing homes with coronavirus cases, they said they came to that decision in consultation with the Federal Centers for Disease Control and Prevention. But a CDC spokesman said Tuesday that the agency had not advised the state one way or the other, saying the decision to some individual nursing homes is up to the State Department of Health. Through April 1st, the state publicly released the names of individual adult care facilities that have been designated clusters of coronavirus, which officials defined as being a place where there were two or more cases that appeared to be connected. 2 days later, the state announced it would no longer name individual facilities, but instead give the total number of homes with at least one case, the total number of affected residents, and the total number of deaths. CDC officials told the state they thought the state reporting the facility names was laudable, but they worried what would that mean for the nursing homes sharing as this continues, said Alex Billio, head of the state's Office of Public Health. Billio also noted that when there were just a handful of clusters, it was easier for the Department of Health staff to reach out to the nursing homes directly. But as the number has grown, as of Monday, at least 7 facilities have reported one case. State officials have grown increasingly reliant on timely and transparent self-reporting by the nursing homes, which are obligated to report COVID-19 cases to the state. But Jason McDonald, the CDC spokesman, said the decision on what to report publicly is left up to state officials. CDC has never issued guidance on whether state health departments should name facilities. McDonald said state or local health departments decide whether the facility should be named when reporting deaths from COVID-19. Nonetheless, Billy on Tuesday reported that the state's decision had come after talking to officials from the CDC. I can say that our current policy we developed in consultation with the CDC, he said. State's decision to stop identifying the nursing homes dismayed national advocates for nursing home residents who previously had praised the state for its transparency. I'm baffled by the reverse course on disclosure, said Brian Lee of Families for Better Care, an advocacy group based in Austin, Texas. I guess it's easier for public officials to mislead families than it is to be honest with them. The decision is also worrisome to the families of some residents in homes, many of whom fear they won't know if their loved ones are in danger or not. If nursing homes aren't notifying families, the state is no longer sharing the information. How are we supposed to keep informed? Asked Jennifer Corsi, whose sister lives in a Kenner nursing home that the state had designated a cluster last week. Information is the only thing we have. Louisiana has a powerful nursing home lobby and have given hundreds of thousands of dollars to elected officials, some of who have ownership stakes in facilities, something that was documented in an extensive series published in The Advocate in 2017. Billio has said the decision to stop listing individual homes had nothing to do with industry pressure, rather was done to keep the focus on the patients. As of Monday, the state says 70 long-term care facilities have reported at least one case among patients, that there were 261 total cases in those homes, and that there have been 103 deaths. The state is expected to update those numbers on Wednesday. And let's move ahead to something a little bit more light. An Easter like no other. Holy season marked by efforts to worship while separate, like Kevin Foote. There won't be Good Friday crawfish boils filling up driveways with extended family this year. There won't be crowds of children racing to find hidden eggs in local parks or neighborhood playgrounds. Special church musical performances will be limited and pre-recorded if they happen at all. This week is the most significant of the Christian faith, culminating with Easter Sunday, representing the resurrection of Jesus Christ. It's also an important week for families. Many schools schedules spring break to coincide with the Easter week so families can gather to celebrate. Because of social distancing guidelines to stem the spread of the coronavirus, this figures to be an Easter week like no other. It's our Holy Week, St. Mary Catholic Church choir member Jim Kimbrough said. They have all the big feasts happening: Holy Thursday, observance of Good Friday, then Easter, special masses you do for each one, and each one has all the special music that has to be sung. This is going to be the first time in over 30 years that my wife and I will not be singing next weekend, and we're just numb. Holy Week events for Catholics, a long list of traditional events at churches across the area will be missing this year, but versions are still available online. On Thursday, the Chrism Mass which normally would be held, in which the three oils are blessed and distributed in a solemn ceremony. It won't be open to the public, but daily masses will be live streamed at noon from St. John's Cathedral. On Thursday evening, the Last Supper Mass, including washing the feet of 12 parishioners, won't occur for public viewing, but the Reverend Douglas Jessitel, Jester Arsenault, and Andrew Schumacher will perform a Mass at 7 p.m. There's no Mass on Friday, the only day of the year that happens, but Jessitel will pray the Library of the Holy Sacrament at 11 a.m., followed by the Station of the Cross at noon. On Sunday, Jessitel will celebrate the Easter Vigil Mass at 7 p.m. Then on Easter Sunday, KLFY TV will broadcast the Easter Sunday Mass from 10:30 a.m. to 11:30 a.m. from the cathedral. Finding a bright side, just like each Sunday since social distancing efforts began a month ago, churches around Acadiana will feature a service with online streaming or Facebook. It's strange on any given Sunday. On Easter, it's beyond strange. When all this first happened, I thought Easter is going to be the hardest thing not to have church for. First Baptist Church choir member Joel Hilburn said, "It's all centers around that. However, instead of focusing on what's missing, some pastors and church members see a silver lining to these strange times. Basically, what's happening is we're stripping away all the extra stuff," said the Reverend James Pritchett, who pastored in First Baptist. "It goes back to the basics of Easter, thus that's celebrating the resurrection of Christ, celebrating victory over sin and death, and celebrating the way of salvation for all of us. It's a complaint more often heard during the Christmas season. All the extras that go along with holidays can dilute the true meaning of the event. In our culture today, we are so busy with other things that the noise of life really is drowning out what's important," Pritchard said. "One of the silver linings of all this is that it really has removed all the noise." Pritchard was supposed to be delivering his first official sermon to his new flock at First Baptist Church on Sunday after a 10-month search to replace departing pastor Steve Horn. Instead, Pritchard's former church in Forney, Texas, will record his message and send it to First Baptist in Lafayette to distribute to its members. "My family is watching our worship service from home," Pritchard said. "We'll sing away with the worship team and we'll nap during the sermon like everybody else is doing. We'll just be a time of family and we'll just focus on Jesus and what he did for us on the cross." The Reverend Jacob Aranza, pastor of Our Savior's Church, gave the analogy of a family's house catching fire. "Normally, there's plenty of things around the house that take up much of our time, but if that house catches fire, your wife, your kids, and maybe a handful of memories, it's all that's going to matter as you try to exit that house safely. Crisis creates clarity," Aranza said. "I think for a lot of people now, Easter is going to be more than it's ever meant before, regardless of where they have it, Aranza said. Getting creative. As much as Aranza believes in that deeper meaning approach, he admits he too struggles with the week's limitations. His staff will pre-record the Easter morning service using technology to make it look as normal as possible, as long as the camera stays away from the empty pews. The only answer I really have, Aranza said, is communion. Communion is very, very sacred, especially in this area. Aranza said he tried to talk to his colleagues into passing out communion receptacles to church members, but the pastors at our 6 campuses made me realize that would create a lot of traffic and violate almost every coronavirus rule set forth by our government officials, and we didn't want to do that. Instead, Aranza is encouraging his church members to purchase grape juice and the appropriate type of bread or wafer so we can all have communion together on Easter Sunday. Good Hope Baptist Church on East Willow Street is making communion kits available to members to pick up in the church parking lot from 10 a.m. to 4 p.m. on Wednesday and Thursday. The Reverend Ricky Carter, pastor, said staff members wearing masks and gloves will meet members in the parking lot to deliver the kits so the membership can take communion along with Carter at the end of the live stream on Easter Sunday. Carter said members will also be given a white ribbon to display on the driver's side of the vehicle. It's going to be an evangelistic tool to share the gospel message for a week, Carter said. Easter is going to be different this year. Usually do so many things that you won't be able to do this year, but I'll tell you what, will be one that we'll never forget. Perhaps the most innovative Easter Sunday service comes from Bishop Alton Gatlin and Gethsemane Church of Christ in God on Pinhook Road. Since social distancing guidelines began in mid-March, Gethsemane has been conducting services on Facebook Live. But for Easter, Gatlin really wanted to bring people together. Much like the old drive-in movie, Gatlin's congregation will join in the church parking lot on Sunday. Each family will remain in the vehicles with a crack in the window to hear the public address system in the parking lot, while Gatlin and a few other church officials bring the Easter message. People will be safe because they won't have to get out of their vehicles, Gatlin said. Well, that's good. All right, so let's, we have a couple minutes here. Let's see if we can do one sports story. The LHSAA to discuss deadline for return, implications for fall to be weighed in meeting as well by Robin Fambrough. A decision on a final deadline, a range of dates to resume spring sports is a key objective for David Federico going into the LHSAA Executive Committee's spring meeting. Conference call meeting is set to begin at 10 a.m. Wednesday, marks the first time the LHSAA board has met since the novel coronavirus pandemic shut down Louisiana schools and high schools last month. Ecole Classiques Federico, the LHSAA president, is eager to see where the discussion goes. I have no idea how long this meeting is going to take or where the discussions will take us, Federico said. We need to get into this as a group, but I look forward to hearing what the other committee members have to say. My hope is that we will have something to determine when that deadline for spring sports would be. One option McDonald plans to offer would be using the indoor track format, which splits schools choosing to compete in track into 2 divisions, Class 5A, 4A, and 3A schools in Division 1, and Class 2A and below in Division 2. LHSAA Assistant Director Adam McDowell said the closure of Louisiana State's colleges would impact the region and state track meets. McDowell said Zachary High has volunteered to host the state meets, but he noted conducting more than 60 district meets along with regional and state meets would be difficult. All right, that kind of wraps it up. I'm a little bit over time this morning for the news. I appreciate you tuning in, listening to AOC's daily morning reading of the Acadiana Advocate news and whatever fits into 55 minutes. I've been Bruce and will always be Bruce, and appreciate you tuning in. If you're interested, once we do get back to our AOC home, our facility in the Rosa Parks Transportation Center in downtown Lafayette, we hope to get there sometime, hopefully in the future. When we do, we would love for you to join us as volunteers to read the newspaper. If you're interested, go to aocinc.org and you'll find an application form there. And we would love to have you come and read with us. It's a great way to get the news out to the visually impaired and for those in the Acadiana area who don't have access to a newspaper or to the news cycle. I appreciate you listening in. Please be safe, stay healthy, and above all, be kind to each other. And have a good morning.